Hello, everyone. Thank you so much for coming out today, especially when it's kind of threatening to rain and dreary, and goodness knows we have enough dreary stuff going on in the world. I think I'd be remiss if I didn't say to take a moment for what's happening in the southern United States and giving prayer to them. But also, we're here today to give honor and memorial to those who have passed away from overdose, a drug overdose, here in Franklin County, as well as in Ohio, our nation, and the world. I want to give honor to those lives and the friends and family members by saying, I am sorry. I'm sorry for their deaths. I'm sorry for your loss. Know that it is preventable. I also want you to know that we're continuing every day to fight the disease of addiction through the work and interventions that have been set forth by the Columbus and Franklin County Addiction Plan Coalition. Vital members of this addiction coalition include Columbus City Mayor Andrew Ginther, the Franklin County Commissioners, Alcohol, Drug, and Mental Health Board Director Erica Clark-Jones, Columbus City Attorney Zach Klein, Franklin County Public Health, and of course, Columbus Public Health Commissioner, Dr. Mashika Roberts. It is now my privilege to introduce Ohio Department of Mental Health and Addiction Services Director Lori Chris. I have known and worked with Director Chris over the past 15 years, and I can honestly say she understands the disease of addiction, she understands the human condition, and the need to provide compassionate, critical, and timely care to those in need. Director Chris.
Good morning, everyone. Thank you, Andrea and Dr. Roberts, for the opportunity to join you here today in recognition of overdose awareness today. It's the first time that Ohio's recognized this, and it's so important because we need to recognize not just overdose, but those who have been lost to overdose as well. Fighting addiction and promoting healthy, drug-free families and communities remains a key priority for Governor DeWine and this administration. And the pandemic has escalated our nation's overdose crisis. And overdose deaths in 2020 are the highest on record, not just here in Franklin County, not just here locally, but across Ohio and across the country. Each death is a heartache. These are our family members, our friends, our neighbors who are tragically lost. And to those of you here that have lost someone who died of overdose, we are deeply sorry for that loss, and we remember their lives with you, not just today, but every day. We must all do our part in prevention and harm reduction. Overdose deaths are preventable. At the state, we're making naloxone available in record amounts to communities across Ohio. This month and next, we're pushing out 120,000 doses of naloxone to communities across the state. This is building on previous efforts, May's 60,000 distribution of doses to Ohio's 23 hardest hit counties and neighborhoods, including Franklin County. We know that local communities know best what to do for the neighborhoods who are most impacted by overdose and overdose death. We're committed to partnering with local partners and champions like the Columbus Public Health and its partners to prevent overdose deaths in Columbus and its neighborhoods in Franklin County. We are committed to equitable distribution of naloxone, knowing that while addiction has no boundaries, people of color and Appalachian communities are harder hit by unintentional overdose death than other parts of the state. And we are accomplishing this commitment with partners like you and Harm Reduction Ohio Coalition across the state. 2 weeks ago, I spent a morning with the Columbus Kappa Foundation distributing naloxone and talking with neighbors and business owners in the Mount Vernon and 20th Avenue area of Columbus. I want to thank Nathaniel and Barbara for their time sharing their neighborhood with me and the important work that they're doing to make sure that they're connecting with each person individually and honoring their experience and offering them hope and help. This neighborhood and others across the state like it are devastated by addiction and overdose, but they've not given up hope. Their continued dedication to saving every life, reversing overdoses with naloxone, and helping people get to treatment is inspiring. We must respond with support and attention proportional to this need, and we are. The DeWine administration is committed to walking alongside all of you as champions on the front line of this crisis every day. Today is also an important day to discuss openly that addiction is a health issue. It is not a moral failing. It is not a poor choice. It is a health issue, and it can and does touch every Ohio family. Addiction is preventable. Addiction is treatable. With health care and ongoing support, people recover. Last Friday, I rode along with the REACT team, many members here today, and we were in the southern part of Columbus. And it was an opportunity for me to see how every day they follow up with people who had experienced an overdose and who had been revived with naloxone or taken to healthcare opportunities because of the EMS response. I was impressed with their compassion, with the time they spent with each family, with the opportunity they took to really honor the dignity of each person they were working with, to offer them information, naloxone, and a connection to treatment and care. As I was arriving, they were taking a gentleman to treatment who had called them after a period of time to say, today's the day, I'm ready for help. And they do this each week, each month, on end. That night, or the next night actually, they had a reunion of people who were involved with REACT, a chance for the community to gather together in recovery and to celebrate the opportunity to recover from substance use disorder. And that's what we're doing here today. We're honoring the dignity of each person lost to overdose death. We're honoring the dignity of each person revived, and we're honoring the opportunity to talk about prevention, treatment, and recovery together. You wake up every day fighting this battle alongside an array of caring professionals, family members, and community partners, and we rely on you and champions like you to help us spread the word about the signs and symptoms of mental illness, of substance use disorders and problematic substance use, of how to seek help and how to know it's okay to ask for help. The work is hard, but we can't grow weary. We'll continue to learn together and from one another in this work, and we will end overdose deaths together. Now I'd like to introduce County Commissioner Erica Crowley. She is a mother, an advocate, and a veteran. And I've appreciated working with her as a member of the Ohio General Assembly, and I'm looking forward to see what she accomplishes here as Franklin County's newest county commissioner. So thank you, County Commissioner Crowley, and welcome.
Thank you. Good morning. I am Franklin County Commissioner Erica Crowley. And while the circumstances that bring us together today are unfortunate, I appreciate all of you showing up today. And for all of the families who have experienced a loss to overdose deaths, please know that our thoughts and prayers and our condolences are forever with you. It's important that we gather here today, even for this difficult topic like overdose. And it's important that we spread the word about both the danger and the resources that are available for people who need them. Addiction is not a private issue. It's a very public issue that is facing our entire community, our entire state, and our entire country. The most impacted neighborhoods here in Franklin County are the Linden areas, south of Livingston, Northland, the Hilltop, and Eastland areas. Therefore, addiction does not happen in a vacuum, and there is no part of our community that is not affected. So it is up to us as an entire community to face it. The Franklin County and Columbus Addiction Plan does that, laying out strategic goals, tactical plans, and specific interventions to help prevent addiction and provide treatment. But overdoses continue to rise because addiction is a complicated, insidious disease. Researchers at The Ohio State University recently found that a person's likelihood of staying in treatment for opioid use drops by as much as 50% when there isn't a provider within a mile, and they identified a number of so-called treatment deserts in Franklin County. They also found that African Americans faced additional barriers to treatment such as discrimination, stigma, and racism. The Franklin County coroner, Dr. Ortiz, reported a 35% increase in African American opioid overdose deaths in 2020. So there is much work still to be done, and we are committed to doing that work. I'm proud of the efforts our community has already undertaken, and I look forward to what else we can do to help end stigma of addiction and prevent overdose deaths in our community. I also want to say to anyone who is struggling with addiction in their life today that you are valued, you matter, and you are loved, and you can beat this. In all of this talk about community-wide plans, we can't lose sight of the individual people and families that are struggling every day with addiction. Don't ever forget that you are valued. Don't ever forget that you have a community that's ready to wrap their hands around you to let you know that you can beat this and we can get through this all together. Thank you again for being here, and now it's my honor and pleasure to introduce Columbus Public Health Commissioner Dr. Myshika Roberts, and I look forward to working with her in my new role. Thank you.
Thank you so much, Commissioner Crowley, and myself and my team, we're looking forward to working with you in your new role, and thank you so much for joining us, Director Chris. We really appreciate both of you and all the support we get from you, not only today, but year-round. Columbus Public Health is really proud to partner with all of you that are here today and all of the members of Columbus and Franklin County Addiction Plan as we all work hard together to help those living with the disease of addiction here in our community. Preventing overdose, as you've heard already, is a very complex issue, and there are no quick or easy fixes to this problem that continues to take many people, whether it be mothers, fathers, sisters, brothers, cousins, co-workers, or neighbors. But what's most important, these are all people who are loved and who are valued in our community, and now their lives are lost. As we continue to fight this ongoing COVID-19 pandemic, the epidemic of addiction and overdose is still here and present and unfortunately thriving in our community. COVID-19 has been difficult for all of us, including myself, but it particularly hits those very hard who are living with the disease of addiction as well as other mental health issues. In 2020, we had 804 unintentional overdose deaths right here in Franklin County, 802. That was a 47% increase from 2019. And as was stated already, the deaths among African Americans from unintentional drug overdose doubled from 12 to 25. Additionally, another 5,826 people overdosed in our community last year. These are people that we know about because EMS was called or they ended up in the emergency room. I'm sure there are many more who overdosed and either were revived on their own or with the help of family and friends that were not reported to us. So you see all these flags behind me. I imagine that there are many, many more that we are not picking up. But these aren't just statistics. These are real people. These are family members, these are co-workers, these are neighbors. And these are individuals whose futures have been cut short because of the disease of addiction. Today you see more than 6,000 flags here representing our friends, our family, and our neighbors who've been impacted by overdose and overdose deaths. None of us, and I'll repeat that, none of us are immune to this. In fact, this issue hit close to home just 2 weeks ago here at Columbus Public Health, we had 2 individuals that either came inside our building or came outside our building who were in need of help of an overdose. And thanks to the team here at Columbus Public Health, we were able to respond quickly with the needed resources to revive these individuals successfully, even before EMS arrived. But it brings home the point of why everyone should carry Narcan. Because although my nurses were able to provide CPR to both of these individuals, it was the Narcan that they were able to provide that reversed the individual's life. In one instance, we had to provide 3 doses of Narcan to revive the individual. In another instance, we had to provide 4 doses of Narcan to revive an individual. So it's really important that if you are out there and you're trying to help people, that you have Narcan, because sometimes you are the thing that will keep that person alive until the paramedics arrive. Overdose deaths are preventable. That is why we have naloxone, and I encourage everyone to carry it like I do. The Columbus and Franklin County Addiction Plan and its partners are distributing free naloxone throughout Central Ohio today at 6 community sites. You can also find those locations and other locations for free Narcan and mail-in Narcan at the Columbus and Franklin County Addiction Plan website. As we come together today and remember those we've lost, we must all commit to reducing the stigma around the disease of addiction and ending overdose and overdose deaths in our community once and for all. Now, we were going to be joined by someone who can talk about the lived experience of the disease of addiction, but unfortunately they had an emergency and they are not able to join us today. And it just speaks to how this disease can be and how we all have to be flexible and we have to do everything we can to reduce the stigma. So I again want to thank you all for coming. I thank all of our partners for joining us today. Thank you to Director Chris and to Franklin County Commissioner Crowley, and we're all happy to answer any questions any of you might have today. Thank you.